well, if this surgical mask doesn't work when I go into a patient's room that has COVID, I have to wear an N95. Why does this mask protect me from COVID as I walk around the hospital, walk around Publix, whatever? It's logically inconsistent. Hey guys, James saying. So today, a little bit of a rant, I guess. I want to talk about two things. One, I want to talk about masks, and two, I want to talk about natural immunity. So with the masks, here's the problem I have with surgical masks, everybody wearing surgical masks. So in the hospitals, I don't know about the world, but across the nation, so I'm a nurse, if I go into a patient's room that has COVID, or I bring a patient to my lab to do a procedure on them and they have COVID, I have to wear an N95. If I'm wearing a surgical mask and I bring this patient to my lab, or I go into the patient's room, then I will be deemed to be exposed by the hospital because the surgical mask doesn't work with COVID patients. You have to wear an N95, and by the way, all N95s are not created equal. I don't like this one, but I digress. So my question is, if I have to wear an N95 mask with a patient that is known to have COVID, why am I wearing a surgical mask as I go around the hospital, as I go up and down the hallway, as I go to the nurse's station, when I go to Publix or Home Depot or Lowe's? People say, well, you're wearing this to protect you from COVID. There's a pandemic going on, James, don't you know? Yeah, well, if I wear this into the patient's room that has COVID, I'm considered exposed. This doesn't work. So only the N95 works. So don't even get me on cloth masks. Everybody knew from day one, even the hospital system came out and said, no, you can't wear a cloth mask. You can't wear a cloth mask onto the facility because they don't provide any benefit. So my question is, well, if this surgical mask doesn't work when I go into a patient's room that has COVID, I have to wear an N95. Why does this mask protect me from COVID as I walk around the hospital, walk around Publix, whatever? It's logically inconsistent. Okay? If this is what protects me, if this is what protects me from COVID, I should wear this all the time. Now, if people were honest and say, well, you should wear an N95 all the time, but they're uncomfortable. I don't know if you've worn an N95 for 8 hours. I have. You get hot, it's hard to breathe, you get overheated. It's tough if you're working. I mean, it's just one thing to be sitting around working on a computer, but if you're doing patient care, these things are tough to wear all day. Now, so am I completely against masks? I think they help some, and I'm not going to get, so I don't have the answer. You know, the mantra, you know, at the beginning of this pandemic, it was so stupid to come out and say, the masks don't work. You know, when somebody at the CDC was saying the masks don't work, was Fauci from the CDC? Nobody wear a mask. Okay, if you would have been honest and say, look, we want you to wear a mask, but there aren't enough masks to go around, and if everybody wears a mask, we don't have them for health care. We don't have the PPE, the personal protection equipment we need for people in the hospitals. If you would have said that, rather than lie and say, don't wear a mask, and then when masks are available, oh, everybody needs to wear a mask. And I understand as the science changes, things change. That happens all the time in medicine, in the hospital. But it's not scientifically logical to go wear this N95 when you're taking care of a COVID patient to protect you from COVID, and then wear this surgical mask because you might run into somebody with COVID and you need protection. Well, then I should be able to wear this in a patient's room that has COVID. See? This mask doesn't protect me from COVID. Does it help some? Yeah, probably. And I know early on, it's like, what were people saying? My mask protects you and your mask protects me. Well, most physicians that I follow, the people that do believe, a lot of people don't believe that the mask really help that much. Maybe 10% helps. Like there's a study that in December was published in Science. It was the Bangladesh Impact of community masking on COVID-19, a cluster randomized trial in Bangladesh. And then that will turn into, well, there was a group of people, they didn't wear a mask, and the COVID rate was, what was it, 8.6%, and the people that wore a mask, they'll say they got COVID, symptomatic COVID, 10% less. So that turns into a surgical mask helps out maybe 10%, and then that turns into a surgical mask helps you from getting COVID. Then that turns into surgical masks helps you from stop getting COVID. To surgical, you have to wear a surgical mask not to get COVID. Okay, well, I mean, if you look, and this is where you get into like your critical thinking skills. Well, if you go look at the trial, and I have a background in pharmaceutical. I did that for 10 years. So it's not lying, but there are ways to present data that are, in a more favorable light. So in that trial, when people say, oh, it reduced symptomatic COVID by 10%, well, that's a relative risk reduction, okay? So what it really did, it was 7.6 versus 8.6. Well, 8.6 relative to 7.6, that's a 10% increase, or is a 10% decrease going down to 7.6. A relative risk reduction, okay? The absolute reduction is 1%. So you have to understand control arms in studies. You have to understand number needed to treat. You have to understand relative risk versus absolute risk. Because I think if you tell people, hey, wearing this mask could reduce your absolute risk of about 1%, I think most people would be like, fuck it, I'm wearing a mask. It's inconvenient, it's uncomfortable. N95 is really uncomfortable. Oh, and the thing about masks, before COVID existed, I promise you, when people wore a mask, when you were in isolation, you had your mask on, and you had your gown, your gloves, and you were in there for whatever they had, and you would take all your stuff up. You never touched your face or your eyes or your nose or your mouth. You were contaminated, and then you get all your gloves and gown off, and then you'd wash your hands, and then you get your mask off, and then you dispose of it in the trash, and then you go wash your hands again. Okay, then you can touch your nose and mouth. That's not the way people wear masks today. So if everybody wore their mask that way, it might help that 1%. If you want to say it the favorable way, 10% relative risk reduction. But this is the way people wear their mask. Even healthcare professionals, because you can't be on alert for 2 years. You see this throughout the hospital. You see it in Publix. You see it everywhere you go. You see this stuff. Or you see people wearing it correctly. They take it off, they take a drink. If this was contaminated, they just set it down. They just contaminated that. Then they pick it back up. They don't pick it back up by the strings and put it back on. They're doing this stuff. They're grabbing the front of it. They're touching it. They're doing this. They're taking it. They're eating and drinking the stuff that's now it's touching their eyes, lips, nose, mouth. So nobody wears a mask the way they're supposed to. Does it matter? No, because they probably don't work very much. They might work some, but not that much. Now, more and more people, physicians that I follow that I agree with, and I don't agree 100% with everything these physicians that I follow that they say, is that it's a one-way protection. The mask protects you. That's what more and more people are saying. The mask protects you, the wearer. It doesn't protect me wearing this mask. It's not going to protect you. That's what more and more people are saying. And I understand people being questioning that, because for so long the mantra is my mask protects you, your mask protects me. And I get it too. Like when people come, when people come to the OR and we're wearing our surgical hats and wearing scrubs and we have sterile gowns on, sterile gloves, and we have masks, we're not wearing all that to protect us. We're wearing that to protect the patient from getting infected, because we're going to poke a hole in your body. We're going to put an incision in your body. Okay? This is so we're not breathing on your incision or breathing on the hole that we poked in you. So it's our hair's not falling out. Our hair's not falling into your incision. It's to protect you. So I get people having the thought, well, no, this mask has to protect me some. And I get it if you say, well, look at this study of people wore masks and they talked and they coughed and they yelled and they screamed and they sang and they spit. And look at all the stuff that showed up. Okay, that logically makes you think, well, that's probably a good idea, but it doesn't prove anything. There is so much in medicine that we thought this was going to work. There are so many medicines that people think, hey, we think this is a good idea, and we're going to spend millions and millions of dollars trying to bring this drug to market, and it fails its clinical trials. I could give you hundreds of examples of things we used to do in the hospital. I've been a nurse for 30 plus years. Things we used to do that we no longer do. I'll give you a few, like I'm a big ACLS person. We used to give bicarb all the time. Why? Because the patients in metabolic acidosis, they've arrested, they're in respiratory, we're going to hyperventilate. We gave sodium bicarb every 10 minutes. And then when it was actually studied, oh, you know what? The people that got bicarb every 10 minutes, they had neurologically worse outcomes. Okay? We used to give escalating doses of epinephrine. We used to give higher doses of epinephrine in the code. We don't do that anymore because it doesn't work. We used to use isoprel, a pure beta stimulator. Oh, you know what? Because you're bradycardic and you're symptomatic, we're going to give you pure beta stimulator. Oh, you know what? That increases myocardial oxygen demand too much. It can cause a heart attack. So there's so many things that we used to do that we no longer do. And it's anything from, oh, you have a Foley catheter, we're going to do your Foley care with betadine. Okay, well now we do it with soap and water. So there are hundreds and hundreds of examples of things that we thought were a good idea, and then it turned out really not to be that good of an idea. And you also have to be careful of drawing these causal conclusions. Like one of my coworkers said, we're talking about masks. Of course masks work. Of course masks prevent the spread of COVID. And I said, well, why do you say that? Because none of us got COVID. Because we all wear masks and none of us have gotten COVID. And I'm thinking, well, we've all been vaccinated. We've all been boosted. Maybe we are social distancing. Maybe we went through a period where we were shutting down. We weren't shutting down. But it's like, well, you can't make that causal connection. I was like, well, you can't draw that conclusion. Sure. I said, we all wear blue scrubs. None of us got COVID. Is it because we're wearing blue scrubs? That's silly. That's ridiculous. I know it is. We all wear scrub hats. Scrub hats prevent you from getting COVID-19. Now you're just being stupid. I said, yeah, I am, to make a point. You can't draw that conclusion wearing this mask prevented us from getting COVID. I said, if this mask prevents us from getting COVID, Mr. Smith is about to go into that room, and I'm making that up because Mr. Smith wasn't a patient. But if Mr. Smith is going in that room with COVID, we're bringing him down here to do a procedure on, you take that surgical mask off your face and you put an N95 on, wouldn't you? Yes, I would. Why? Because the surgical mask doesn't work. Okay, so I guess enough about that. The other thing I want to talk about is, I don't know why, in the history of virology, never has it been that you got an infection to a virus and that doesn't count as an exposure. That doesn't count as you building up your immunity. Look, I'm very much for vaccines. I'm double vaccinated. I've been boosted. I'm over 50, so I think everybody over 50. By the way, if you remember, when the FDA advisory panel was saying, should we advise the CDC to recommend for boosting, 17 out of 18 said no, we don't. One person said yes, 17 people said no, we don't recommend it. And then in their second meeting, the day before their second meeting, and this came from Paul Offit, who sits on the advisory board of the FDA, said, okay, Israel came out with the data with a study saying people 70 to 79 benefited from being boosted. And so they said, okay, yes, we will recommend people over 65 getting boosted. And then Omicron hit, and then the White House, the CDC said, boosters for everybody. So I'll go off on a tangent. It's not the boosting and the 3 or 4 month rise in antibodies. It's your memory T cells and B cells. That is what provides adaptive immunity. But that's another video. That's another thing to talk about. So I think if you're at high risk, if you work in healthcare, the third booster, if you're over 50, if you have comorbidities, the booster is probably a good idea. Young, healthy people getting boosted, but I digress. So I want to talk about why people don't count getting a COVID infection. That basically takes the place of one vaccination. If you survive a COVID infection, that's better than getting a vaccination, as long as you don't have any long-term symptoms. Why do we get vaccinated? It's to prevent serious disease. Okay? You get vaccinated. In the old days, people would take an attenuated or a killed virus, or attenuated, partially live virus, or take out the replicating part, and you would get the virus. Here's the virus. That's your vaccine. We're giving you the virus so that your body can make antibodies and develop T and B cell memory to that virus. So yes, that is better than I'm going to roll the dice and get infected and maybe have a serious illness or maybe not survive the infection. Is it better to get vaccinated than to get the disease? Yes, because if you get vaccinated, you're not going to get sick. You may have a day or two of some unpleasant side effects, but you're not going to get sick like you could with getting the natural infection. But if you got the natural infection, you got exposed to the whole, like with the mRNA, like they're really promoting mRNA, which I agree, over the J&J. But you get exposed only to the spike protein. When you get COVID infection, like if you got Delta, or what was the Beta before Delta, or you got Omicron, you get exposed to the whole virus. Now, if people were honest and say, look, we want you to be vaccinated because we can't track who had COVID infection. We need people to get vaccinated. It all became political. You stop listening to even people in the medical community became political. It needs to be driven by science. And then people, I said science, so it must be true. It needs to be driven by the thought leaders in our medical community who are not political. So I'll end on this. In the history of virology, okay, in 1995 they came out with the chickenpox vaccine. I never had chickenpox as a kid. So when I was taking care of a patient with shingles, it comes from the same family of viruses that cause chickenpox. If they had draining lesions, I could get chickenpox from the patient who had shingles. And as soon as they came out with the chickenpox vaccine, it's like, for all you people who it came out in 1995, for all you people who did not have chickenpox as a kid, we have a vaccine for you. Guess what they didn't say in 1995? Everybody, come get a chickenpox vaccine. Why? Because if you had chickenpox as a kid, you were exposed to it. That counted as your exposure. Now you have an innate immunity to it. You can fight off chickenpox. Okay? It's the same with COVID. If you got exposed to COVID, that should count as one of your vaccine shots. All right, so I'll end on that. All right, guys, this is really just one, try to get out of your camps of conservative, liberal. You can't tell me what to do. We got to do what's best for the whole community, and use your critical thinking skills. It's fine. It's good to question everything. But just don't go out and find people who believe what you believe, and therefore, so somebody supported my opinion that I already had, and this just cemented it. Use your critical thinking skills. And if you're going to critique people who are using critical thinking skills, you have to be a good critical thinker yourself. All right, guys, thanks so much. If you liked the video, hit the thumbs up. It'll help my channel. If you found the information helpful or useful, consider subscribing to the channel. And if you do, remember to turn on notifications so that you don't miss when the next video comes out. All right, guys, thanks so much. We'll see you in the next video.